My name is Dr. Lois Mutai. I'm the medical superintendent of Pagathi Hospital. We have come here to receive the extremely kind donation from Betking Kenya of BOC oxygen. The need for oxygen in the hospitals is up in the roof. We need a lot of oxygen because of the kind of thing we are going through, the COVID pandemic. Oxygen supply previously has been adequate, but since the COVID started, because of the high need of oxygen by COVID patients, the oxygen supply has been inadequate. We've been struggling. Even the oxygen cylinders are not enough. This will come in to fill a big gap of oxygen need. We are going to be using it because of the COVID patients and also other general. But we have coped kind of. The number of cylinders that we needed before were enough for our patient population. But since COVID started, sometimes we use in excess of 10 cylinders a day. Yeah, that means you need to be having 10 cylinders running, 10 cylinders going to get the oxygen. And sometimes, because of the high need from all facilities, you find a big queue, and the truck that gets the oxygen may queue there a whole day, and sometimes we even run out. So the need for oxygen has been big, and the supplier has been trying, but the need is huge. So this BOC gas, courtesy of Betking Kenya, is going to help us. Yes, they are giving us 100 cylinders. They'll help us at least for a good amount of time.
All right, my name is Derek Motley. I'm the head of department for marketing at Kenyatta University Teaching, Referral and Research Hospital. And this is my colleague here. He's Hosea, who's a biomed engineer. So on this occasion, we want to thank Betking and BOC Gases for providing us with 500,000 worth of oxygen and oxygen consumables. As you know, we're a COVID-19 center. It is very important. It's the beginning, I think, of a very good, fruitful collaboration, because Betking have realized the need for oxygen. They have realized how, as a level 6 referral hospital, many of the private hospitals and many of the public hospitals refer their patients to us. So oxygen is a very crucial part of our need, and Betking recognize that, and for giving us 500,000 worth of oxygen and consumables. We really appreciate that, and we hope this will be the beginning of a long, fruitful venture together. And thank you for that.
My name is Hosea Juguna. I'm a biomedical engineering technologist from KUTRRH. I work in the medical engineering department. Our major works in the hospital are maintenance, repair, installation and commissioning of medical equipments. And so in my capacity, first let me appreciate Betking for seeing it very important to give us a hand in terms of oxygen, as we all know that it is very vital for the COVID patients. I'm here because of technical matters. So what I'm holding in my hand is known as a humidifier. This humidifier, you put water. When you put water here, it is supposed to moisturize the oxygen which is going to the patient. You cannot give dry oxygen to a patient. And the white part there is known as a regulator. The major work is to regulate oxygen, the pressure, so that it can be able to go to the patient. We have the regulator where you regulate the liters per minute going to the patient. We also have this is known as a mask. This is what will go to the face of the patient. Some of the times you will find them with nosoplans, and other times they will use this mask. We also have other consumables which maybe are not here. In sometimes in our critical areas, we will need double stage regulators. This one you use whereby you have a big cylinders like those big ones, 8.5 meters cubic. So that double stage regulator, it will now get oxygen from the cylinder to a machine such as a ventilator. Now for these other small cylinders and the flow meters that you can see there, they are used to give oxygen from the cylinder to the patient. Then we have other regulators or oxygen flow meters, whereby they are used for piped oxygen. When you have a piped oxygen in the hospital, you'll have the one that you'll put in the wall where you have your oxygen, and then you'll supply to the patient. So we have those three types. And then we have in a hospital setup like ours, we have oxygen plant. This is a plant that is used to manufacture oxygen from the air, convert it to oxygen that will be used by the patients in the hospital. So thank you.
My name is Marian Mwangi. I'm the Managing Director of BOC Gases. As you can see here today, we have some cylinders behind me, which are donations that are going to Bagathi Hospital and to KU Research Hospital. We're very, very excited that corporates are now coming up to donate medical oxygen to these hospitals so that patients can receive good oxygen from BOC.
And tell us more about your partnership with Betking.
Our partnership is really with the hospitals. I think the demand for medical oxygen has really risen during these COVID times, and even the awareness of what oxygen is used for has also risen. So we have strong partnerships with KU and with Bagathi, long-standing supply relationships. And I think today's event is really about them receiving a donation from Betking. So the relationship with ours is really with the hospitals, and we know the need is big, and we know that the need will be addressed with this donation that Betking has done. So we just want to say congratulations to Betking and to the hospitals for coming together to raise the oxygen access in those two hospitals. The Betking donation is valued at about 1 million shillings. 500,000 will go to Bagathi, and 500,000 will go to KU. In their demand system that will supply many cylinders, I think that will cover them for more than a month's needs in these times. Right now the demand is stable. It's not as high as it was 2 months ago. We are meeting the demand quite easily, and unlike 4 weeks ago when it was difficult. As you can see, we don't have many people waiting to be served at the platform. So the demand is, the entire demand that is coming to us, we are meeting it 100%. So it has lowered, and we hope that we can sustain availability of medical oxygen even with this donation.
Hi everyone, I'm Ivana, and I'm Country Director of Betking Kenya. Happy to be here today, happy to be a part of this amazing donation. You saw how the heart moving and the speech from both hospitals were, and sort of brought tears to my eyes, and I'm very happy that we can be part of this donation. This is only not the last one. This is part of a much bigger initiative that Betking is set to do here. It's part of a much larger CSR activity, enriching lives. This is our theme, and I'm hoping that you guys will follow this because I think it's important. Going back to our communities, bringing back something to our communities, but we felt it was very, very important to start with hospitals, giving everything that's been going on in the past year. So I'm very thankful for all their work, for saving lives, and I'm sure this donation is going to make lots of impacts in changing lives of everyday patients there. This partnership is a donation of 1 million Kenyan shillings, and it's around, I believe, 100 tanks for each hospital. So it's just it's a big donation. They need more, obviously, and I hope that other companies and other businesses will follow this and chip in and help. We've actually selected these hospitals based on their needs. We had to go and do a little bit of research, and we've met with different hospitals, and these two hospitals were actually the ones that really, really needed the most.
How important is this CSR activity to you, and also maybe the safety of the gases?
Well, it's very important because on a bigger scale, you're able to make an impact and a change for one life. I think you have done a good job. You can go back home and know that you've made an impact. Certainly this is something that's going to make change for a much bigger number. It's going to help people in the hospitals, because I know how they stressed when we were talking with them. They were very stressed with the lack of oxygen, and I think this was very well made aware. The public was aware in the media how crucial the lack of oxygen actually was. So I think in that sense we are very happy to be part of this.
Apart from the health sector, which other areas are you looking to maybe assisting?
Yeah, well, I think it's the Betking Enriching Lives initiative is going to touch base on different communities. So it's going to be medical. We are starting with medical sector, but it's going to be a part of a much larger initiative where we're going to go into local communities, see what they need. It will be around what the communities need. If there is a need, something specifically that they'll need help with, we'll do our best to help.